Okay.
This meeting is being recorded.
Hi, everyone, and thank you so much for joining us. I'd like to start by introducing ourselves. I am Dr. Chaviva Molina, and my partner is Dr. Cheryl Molina. Yes, we are related. We are sister-in-laws and both practicing ER physicians. We were inspired recently by the detrimental effects that the pandemic has had on our patients in the ER with psychiatric illness. We did some research on ketamine and decided ultimately that there was a real need for a new ketamine infusion center here in Northern New Jersey. Since our opening in December, we have been partnering with mental health providers who have referred patients to us that could potentially benefit from ketamine as an adjunct to their overall treatment plan. We wanted to share some of the newer findings on ketamine. As a clarification, we do not do the therapy. We simply administer and monitor the IV infusions.
Hi. Okay, so I'm going to start with a brief history of ketamine. It was discovered in 1962 and approved by the FDA in 1970. It provides sedation, pain relief, and amnesia. It was used extensively in the Vietnam War to treat wounded soldiers because it's quite unique as an anesthetic in that it doesn't cause respiratory suppression or low blood pressure. And that means it can be used without respiratory support, and it can be used for patients who are quite ill or in shock or have a tenuous blood pressure. It's quite safe. And because of these advantages, it continues to be used as an anesthetic and sedative in hospital emergency and operating rooms. And it's used for both children and adults. About the year 2000, it was discovered that in lower doses that are called sub-anesthetic doses, ketamine can have a robust and rapid antidepressant effect. Studies for depression were done in the context of treatment-resistant depression, where a person had at least 2 prior conventional treatment failures. It has been studied for a variety of mental health disorders, and there's evidence for use in treatment-resistant depression, bipolar depression, suicidal ideation, PTSD, OCD, and some substance use disorders. I'm going to go through a little slice of the research, starting with a meta-analysis from CHRIST. And they were looking to evaluate the efficacy of antidepressant effects of first a single dose of ketamine and then repeated doses of ketamine in unipolar and bipolar depression. So 20 randomized control trials were included in this meta-analysis. And here, first we see the results for the single dose administration, and it shows consistently a benefit of ketamine versus the control from 24 hours up to 7 days post-infusion. And peak effects were at 24 hours, and then small to medium effects were still present at 7 days. And this is the standard mean difference. And all studies but one showed a benefit to the ketamine group. You can see the distribution to the left side of the graph showing the benefit to ketamine. And then these are the results from the multiple dose treatments and looking at 2 to 3 weeks post repeated ketamine administration. Full data showed a significant reduction of depression severity scores in the participants who received the ketamine infusions. And again, you can see the distribution on the left side of the graph showing the benefit of the ketamine treatments. And then just quickly regarding PTSD and OCD, a randomized control trial of repeated ketamine administration for chronic PTSD by Fetter. And this study included 30 individuals randomly assigned to receive either 6 infusions of ketamine or using midazolam as a psychoactive placebo control. And they were given over 2 weeks. Using the CAPS-5 score, it showed a significant and rapid reduction of PTSD symptoms. 67% of ketamine participants were responders versus 20% of the midazolam group that were responders. And the effects lasted a median of 27.5 days. So that's a full 4 weeks of response. And then a study by Rodriguez using ketamine for OCD. And there were 15 participants in this study. They were medication-free with near constant obsessions. They were given a single dose of IV ketamine, and 50% of those receiving ketamine met criteria for treatment response versus 0% in those receiving placebo. and effects were still persistent at the 1 week mark. So what's the mechanism? How does ketamine work? Okay, so the most potent effect is as an NMDA receptor blocker, and that receptor activates an inhibitory neuron. So it's basically blocking a blocker, it blocks the NMDA that would then cause the inhibition. So by blocking the blocker, it allows an increased glutamate release, and then that surge of glutamate increases the activation of the AMPA receptors that you can see at the bottom of the synapses. And in turn, the activation of the AMPA receptors induces a series of signaling cascades in the cell. And that includes stimulating mTOR receptors as well as increasing release of BDNF. This ultimately increases the number of synapses and neurons and modifies the pathways between cells and creates new neural networks in the prefrontal cortex. Ketamine also has other lower affinity targets, including the monoaminergic system. It also increases the effects of GABA. It antagonizes cholinergic neurons, and it's a weak agonist of the opioid system. And all of these symptoms combine to allow immediate antidepressant, anxiolytic, analgesic, and psychotomimetic effects, as well as delayed effects that are connected with neurogenesis and neuroplasticity. So those are the neurobiochemical benefits. There are also more subjective psychological effects. You may hear about blocking the default mode network. The default mode network is a state of consciousness when a person is not focused on a task. It's perhaps best called a daydream state. And in that state, there's a vulnerability for a person to get caught in a loop of negative thoughts that someone might tell themselves. I'm not good enough, I'm not smart enough, whatever it may be. And during the ketamine effect, that network is blocked to a degree, and it gives the person a rest from that negative narrative. Also, during the immediate ketamine administration, there's often a hypnotic dissociative component, and that can help the patient access memories and unprocessed feelings, and in turn can help them in healing. And that can be particularly helpful for traumatic experiences. And those memories and emotions are very useful to bring back to the therapeutic arena and to continue processing those with the patient's therapist. And research is always continuing to describe other ketamine effects and areas that may benefit from its use.
Well, I'm going to go through the advantages of ketamine over traditional medications. So firstly, the onset of ketamine is fast. People generally feel improved mood and motivation within hours to days after infusion. In addition, unlike traditional antidepressants, there are really no undesirable chronic medication interactions or side effects, such as decreased libido, increased weight, and those are often the reasons that patients don't tolerate those medications. There are two main types of ketamine administration. There's intranasal and there's also IV. So we have to kind of go back to the molecular level. There are two different types of molecules. One is S-ketamine and one is R-ketamine. These are called isomers of each other, which basically means that they're mirror images of each other. Intranasal ketamine is made up solely of the S-ketamine, whereas IV ketamine is the racemic version, which means that it's a mix of both isomers. So intranasal ketamine, which is known as Spravato, is FDA approved for treatment-resistant depression and major depressive disorder with suicidal ideation. It is covered by most insurance plans. And the protocol for the induction phase is twice weekly for 4 weeks, then once weekly for 4 weeks, and maintenance is once a week, every 1 to 2 weeks. In contrast, IV ketamine has not yet been presented to the FDA for psychiatric indications, and therefore not yet covered by insurance. It has been shown to be more efficacious, however, than intranasal ketamine. The protocol for induction is 0.5 milligrams per kilogram IV over 40 minutes. There are 6 treatment infusions over 2 to 3 weeks. and there's maintenance infusions every 1 to 3 months as needed. Just to give you a frame of reference, in the ER, we use ketamine at much higher doses as an anesthetic, 1.5 milligram per kilogram. So this is a lower dose over a period of 40 minutes. Most people feel improved mood and motivation after the 1 to 2 doses. And some people, feel better after the first, and some people don't feel better until the 6th treatment. So there is some variability, but usually by the 3rd treatment, people are starting to report, improved mood. The effects of ketamine, as I mentioned, improve mood, motivation, and decrease suicidal ideation. And those benefits are found to manifest 1 to 6 weeks post-infusions. Studies have also pointed out that the reduction in suicidal ideation is an independent endpoint from its effect on the depressive symptoms. So ketamine potentially can work in multiple ways to improve mood and motivation. There are several contraindications to ketamine. One is uncontrolled hypertension, uncontrolled hyperthyroidism, active mania, current psychotic symptoms, active illicit substance abuse, pregnancy, glaucoma, and intracranial pathology. And these are things that we screen for in our center before initiating any infusion. It's also important to note that there is no evidence that medically supervised ketamine therapy increases the risk for substance use disorders. Side effects are mild and transient. They typically reverse once the infusion is over. There are different categories of reactions. The first is neurologic, where a patient can feel dizzy or lightheaded. The next is hemodynamic, where ketamine has cardiac stimulating effects. So you could get a transient elevation in heart rate and blood pressure. And finally, there's the psychiatric, the most common, which is dissociation, which is defined as a disconnection between thoughts, perceptions, and surroundings. Pretty much in our center, we are equipped with all types of medications, reversal agents, and equipment for pretty much any possible scenario. In summary, ketamine is a very safe and quite efficacious treatment for multiple treatment-resistant psychiatric conditions. We really appreciate your attention, and please reach out and be in touch with any questions or concerns. Our website is at the bottom, mgmiv.com.
Hi, thank you.